Hello, my name is Stuart Sutton. This is a project sample. It's titled the 2019 NCOV sample. I am the team member as the professor for this class. So the introduction is that this is to address the 2019 novel coronavirus, and more specifically, it's to look at in some detail the counts associated with recorded infections, the number of individuals who have been recorded as having recovered, as well as the recorded deaths. When we look at the data, it's a very simple data set that we acquire, and this is the reference location for that data set. It includes record date, the province and state where the data was recorded, the country of origin, and the three metrics that I'd referenced: confirmed, deaths, as well as recovered. The 2019 coronavirus is affecting countries all around the world, so it is a worldwide challenge. But it turns out that the concentration of activity that is most significant is in the province of Hubei in Wuhan, China. So the case counts there are the highest because that is the epicenter of the infection. When we look at the trends, we notice that the case counts do follow a very easily configured polynomial. And we notice that the r-squared and p-value for the polynomial case counts allows us to make a reasonable prediction for both the case counts, the recoveries, as well as the deaths. The forecast that we can make shows us a predicted growth in these case counts based on the current data that we are using. The elephant in the room, or that thing that is unfortunately not being talked about, is the difference between the total case count when we subtract the recovered and confirmed deaths. As the weeks go by, this gap is increasing, and this is an increasing unaccounted population. We don't know if these are individuals who have either died or recovered. They're not being qualified in either of those categories. That is troublesome. The calculations for the case fatality rate is as follows. It's the deaths divided by the total cases times 100 to give us a percentage. For February 14th, 2020, that resulted in a CFR of 2.4% based on the data that was reported. But we believe that there is potential underreporting in the data. Figures coming out of China are being questioned worldwide. One basis for calling these figures into question is the significant rise in the daily cremations that are taking place within facilities across China. Cremation facilities are reporting anywhere between 5 to 6 times increase in the number of bodies being received for cremation. Yet the total figures being reported out by the cremation facilities, which would be the deaths, is only about 7% of the total bodies being cremated. This is a significant impact, we believe, in this underreporting. And what it does is it impacts both the accounts we have for the known deaths, and so thereby we would assume that we are significantly underreporting, or we're seeing significant underreporting in the actual case counts. When we look at that forecast and project that out, we see much bigger numbers. We also notice that that gap of cases which are unaccounted for, is also rather large too, as we look across the time frame going forward, but as well the current time going back. Our suggestion is that in order to improve reporting accuracy, that there is international pressure brought against the country of China to encourage them to accurately report all figures. This could be done by allowing international health monitoring, by allowing outside healthcare workers and statisticians access to Wuhan, China.